Sure, perfect. Now we're gonna move to the panel. And this way we were gonna have enough time for the leaders in the panel to have enough time to speak about the leadership in time of crisis. So we're gonna start with Elliot. The floor is yours.
Yes, hello, and welcome everybody. I'll be helping coordinate our panel. Welcome to the panelists. If everyone would turn their videos on, I would appreciate it, because really we're going to have some comments from each of our panelists, and then we're going to talk as a group. I just want to make a few points that come from my own 45, near 50 years of experience in this field. One is leading people and managing things. When you're in the midst of crisis, people need leadership. Yes, they have to have punch lists, to-do lists, assignments, but they also need the confidence of a leader in front of them. They know they have backing and support. There's passion, compassion. From Stephen Covey, first things first and begin with the end in mind. When you're working at, as Mladen pointed out, prioritizing is really important, and understanding that the situation changes day to day, sometimes hour by hour. You may have to recast your goals hour by hour or day by day, depending on circumstances. The airplane pilot's mantra for Mayday: communicate, confess, and comply. If you have a problem, communicate the problem, tell your staff to communicate it, confess what the problem is if there's been an oversight, a failure, and then comply. Come up with action plans to solve the problem. I always hope for the best, but I plan for the worst. So, you know, I hope things will turn out, but I always spend a lot of time and energy thinking about what could go wrong. And especially in crises, you find that things unfold in unexpected ways. Again, Mladen, I think you had a great diagram of all the ways things collide and the disorder that happens. And then lastly, I think Jennifer DiFrancesco said, I'll say it differently: lean in. You have to step up to the plate. You absolutely can't lean back. You can't hide. In the midst of a crisis, they don't go away. It's like confronting a bully. You've got to step in and make things happen. I'm going to move along then to allow Maria Castaneda to do a presentation, and then we'll move on to our good friend and colleague, Adriana Velasquez. I think we have a recording from.
And we're gonna pass that on to folks, but not do it right now. And so I think Ashenafi is going to be next, and Adriana is going to be a part of the panel and just respond to some questions here in a few moments.
Very good.
Thank you.
Ashenafi?
Can you hear me?
Yes.
Thank you very much. It's been a pleasure for me to present in this big occasion. So I think during the time of COVID, especially when it comes to leadership, I think the leaders have continuously communicate to create awareness about the disease, and but the material about the awareness creation was limited, but it has increased gradually through time. And leaders has encouraged innovators to come up with innovative ideas and creative issues to tackle this new virus. And support for HTM leaders, especially support from the leaders, especially sharing manuals, guidance has increased throughout. And one thing that's so interesting is the use of online platforms, just like the one that we're using now. And social media has increased substantially, especially by great leaders of HTM, which was not the case previously. But there were challenges when it comes to supplies and regulatory schemes pertinent to the innovative products that were created. But I think as a leader, as a HTM leader, I think we have to learn how to live with crisis. I think COVID has showed us how to live with crisis. So we need to keep on doing it even from the time on. And we need to have this togetherness. You know, what we are doing right now is we're just create togetherness, and we need to work on other diseases other than COVID. And we need to have also an alert system and prepare better for emergency preparedness in the future. So I think these are what leaders, HTM leaders, need to do maybe in the future. And these were the lessons we have learned. And thank you very much for the opportunity. Thank you again.
Thank you, Ashenafi. Now we'll ask Adriana Velasquez from WHO to share her thoughts. And obviously she's had a solid year of leadership crisis experience and has done a marvelous job.
And Adriana, I know you just joined us, so whatever you've been working on, tell us about it.
Thank you very much, everyone. It's really wait 1 second. It's really a pleasure to be with all of you today. So I was just pointing out some comments that I really want to share with you. In times of crisis, that's really when we really need to focus on the last mile. So what is happening with the final user? Can we really help that final user or final person that needs something to reach or provide whatever is needed for him? Be it oxygen, be it technologies, be it training. So that is something very important. Second thing, prioritize. We have so many things, and if you could see my desk and my inbox, it's full of things, but you need to prioritize what things are more important and could give more input, more impact on the ground. So when Tom said that you were going to be here and it's about 80 and from 80 countries, I said, okay, let's prioritize this and give a 10-minute to you, although I couldn't come all the time. So I'm sorry for that. Secondly, share information. And I'm really glad of what CED is doing about sharing these links every time. So let's share information, everybody, because keeping it to myself, it will not help anybody. So this is a time of transparency. This is a time of sharing information. And this is also a time of collaboration. So everybody can help you. Even the person that you said, oh, this is just a junior student, oh, this is my super boss, and he would not. Just put everybody together in the same boat. If we have the same goal, we will innovate and we'll find new roads to reach that place. Don't use the common roads that have been, we've been walking through them many times, but that has not led to really the change we want. So innovate means changing, finding new options, new ways of doing things. And I think that's something that really, really has helped us in the COVID times. It's really, how can we work with others in a different way that we had ever done? And I think Zoom and many others, it's really the answer. Listen to the voice of the users. Who is, what do they need? And listen to them. Don't try to impose things, just listen so that you can find a response to them. If they need maintenance, if they need training, if they need equipment, if they need whatever is needed. And well, look for collaboration. So for me, health technology management is just one piece in a big puzzle. So how can we make it happen? How can we make ourselves noticed? And how can we help save lives today? So let's innovate not just with a product, but also the way we work together. So thank you very much. Those were my quick messages. And remember, the patient is first, then everything else. Thank you.
Adriana,
never give up. I remember you saying that.
Never give up. No, even if you're tired, like I am.
Absolutely. I want to spend a few minutes asking Riyadh, who also dealt with a staggering crisis and has not had a chance to comment, and then we'll go to the entire panel to open up the floor. Riyadh, any observations from a life-changing experience that you've been through?
Yeah, just in less than 1 minute, I can say one thing. During a crisis, nothing that we clinical engineers, we do the same as a normal operation. Everything is under crisis. Spare parts are not available. You need to have a proper asset inventory management just to know where are the devices and what are the features available there. What can you share? What can you pull from other departments and use it in that specific department? How can you innovate? How can you transform the ER into an ICU? How can you transform a ward, a department into an ICU? Here comes the experience, the information on the facility design, on everything else. Well, I can say one thing, under crisis, really leadership is very essential for clinical engineering. We cannot just sit there and try to do things in the normal way. We have to come up with new solutions because nothing can wait. Patients and we need to offer the services in a different way. Thank you very much.
Thank you, Riyadh. We're going to open the floor now to the panelists, and I'd like you to address this question of what, specifically to leadership, not management, leadership. What are the qualities, what are the lessons, what are the experiences that you would like to share?
And I think Mladen, you had your hand up, or Adriana also.
I think setting the example. It's not ordering things, but setting the example. If you start by, you can lead by setting the example, not by ordering and or commanding things. Over.
Always.
Thanks. If you go back to the framework that I showed in my second slide, I think in scenarios like this, including Riyadh's, leadership is about identifying which of those 5 spaces one is in, or what combination of those spaces one is in. So that provides clear guidance to those looking to you as to what they need to do. They might be very confused by a complex space. Thanks.
Good points. Others who would like to suggest or share your experiences?
Elliot?
Yes, please, Ashenafi.
Yes, I think empowerment is something that we need to work on as HTM leaders, because we need to empower clinical engineers on decision making. So I think that's one of the areas that we need to work on. And the other one is we don't need to be leaders. We need to be coaches. We need to coach the young clinical engineers as a leader. Thank you very much.
Excellent point. And I'll to kind of piggyback onto that. Leadership can be learned and trained. Every military school around the globe trains leaders. The skills of management can be trained as well. Every leader has different skills, capabilities, personalities. Not everybody's a George Patton, but everybody can learn leadership skills, and it requires practice. And that's where the coaching for and mentoring for newer entrants into this field. Others, Manish, you have your hand up. Would you like to share some thoughts?
Yeah. You know, I would echo the comments that the panelists have made, but I'd also touch on innovation. And I think innovation is sort of viewed as something that an organization does, and oftentimes around a shiny new object. And I will take a different perspective, and from a culture perspective, everybody is an innovator. And I think a leader's job is to really bring that out in the individual. Frontline individuals sometimes have the best solutions. And so really sort of setting the expectations that innovation is not something one does, it is who we are. And I think really empowering individuals to really think about problem solving and feeling empowered and supported is an important leadership assets, especially in the times of crisis.
Thank you, Manish. Dr. Kohli, you're brilliant. Thank you. Other perspectives? I'm sure we all have battle scars to share and learnings and wisdom. I'll give a tip while you're thinking. One of the things I was taught in a leadership course relates to showing your troops that you're willing to lean in and take the hard stuff. You used to say when we led month-long trips, first day of the trip, take the dirtiest jobs and do them. Show your team that you are not above whatever the hard work is. I have to say, Adriana, as an incredible example, she said lead by example. I've never seen anyone work as many hours of a day or as many days of a week or a month. People can't say they don't have time when you have leadership that's working at that level.
Mm-hmm.
Who else would like to share perspectives? Dr. David, would you like to share some of your experiences? Because I know you have many.
He may have had to depart.
That's fine. Tom, how about sharing some of yours with Kaiser Permanente at the size and scale and the rate of change? What were your experiences?
Well, I'd rather open the mic for Carol Davis Smith, who's in the audience and who was my boss there. But no, I mean, Kaiser Permanente, 12 million patients in the US, 7 or 8 different geographic locations. Understood early on that it's about the patient. and that, you know, and it's about empowering clinicians, and it's about putting not only the medical device tools, but the digital health tools in people's hands, and, you know, making their job better, quicker, faster. Did I get that right, Carol? So, you know, they've been trying hard to do that for a long time, and, you know, that's put them in pretty good stead in the current crisis.
Thank you. Shaina, would you like to speak up about working in a minimally resourced environment? Because you've got a lot of skill and experience with that.
Sure, Elliot, thanks. Yeah, I'd like to echo what a number of people have said already. I mean, in times of crisis, it's often amazing what a small group of people can do when they're motivated and trying to make change. I'd say also, I always like to reflect on, it's a term, the kind of buzzword term is reverse innovation, but there's absolutely so much learning. Sorry about the sun in the background. It's nice and bright here today. There's absolutely so much learning that can come and does flow from low resource settings, which are places where people can do amazing things with very limited resources, and they're learnings that we can apply in higher resource settings. And to be honest, I found that particularly in times of pandemics. I remember when COVID was starting a year ago, and I remember, you know, chatting with friends around the world and colleagues and following the news and seeing what was happening. And in terms of some of those initial information sharing systems like contact tracing, but the public health surveillance, being able to get public health messaging out to people really quickly, using the radio, using whatever technology was available locally, that was done incredibly effectively and much more effectively in lots of countries in Africa, for example, than in higher resource settings, because those systems are in place. They're very robust. And there's a lot of learning that can be done there. Also, things like rational use of technology, like what's the most basic technology, you know, that's appropriate as a tool for a care provider to do their job with. There's a big focus on appropriate technologies in low resource settings, and a lot of those learnings can be applied and had to be applied, to be frank, when there weren't enough ventilators to go around and when there weren't enough monitors to go around. So yeah, that's been one of the most interesting learnings for me. And I do also find, I've worked on a few different emergency responses. Like I've done a lot of work in kind of routine stuff in low resource settings, like just trying to deliver services, but also I was working with UNICEF when the West African Ebola outbreak happened, and I was in Guinea for a while doing some supply planning and equipment planning there. And the being able to kind of close the gap or narrow the gap between people who have enough resource and enough kind of authority to make decisions quickly, and whoever is on the front line of what they're trying to do, which doesn't even have to be frontline service delivery. Like I'm thinking of all of the amazing staff in the main UNICEF warehouse in Conakry in Guinea, just being able to spend hours with them every day, trying to figure out their workflows and how they were managing what was coming in and out and what information they needed from the big donors who were funding a lot of stuff coming in. Being able to narrow those gaps, that's something beautiful that often happens in a crisis and doesn't happen as often for lots of us who work in kind of very structured systems. So that, yeah, that's something else that I find interesting and inspiring in this type of context.
Excellent points. And empowering your team is really, really critical. In the military, they talk about the sharp end of the spear and empowering people to act so that they know they'll be supported. Where is that brilliant sun that you were seeing, Shaina? Where on the planet are you at the moment?
Yellowknife in the Northwest Territories. Yeah.
Above the Arctic Circle.
Just below it, about 600K below it. It's minus 47 with the wind chill here today, but it's a gorgeous sunny day outside.
Well, glad you're able to join us.
I can't complain. Yeah.
Rossana, let's tip the scale to the other end of the planet and say a few words from an experience of both economic, political, and scientific challenges over this past 6 months to a year.
Well, thank you, Elliot. It's been an amazing, unexpected, and unique period for clinical engineers around the world, certainly in low-income settings like Peru and other regions, of course, we think a lot about how to do better. How to do it better at the same time you are in the middle of unpredictable context, even your life. So I will take these few minutes just to say how much I appreciate the outstanding quality of my partners and colleagues today. I will keep very much the words from Adriana. Focus on the patient, yes. Be able to observe, to listen, and also to think about making changes, not just through the product, through the technology, but also with your own action, with your individual trace. And that is a very powerful insight, as well as Manish saying, innovation is who you are. You cannot work or talk about innovation without being part of the process. Thank you.
Thanks very much. And I'll tell you, I told my staff through the years I've worked that you need to realize that someday it will be your mother or father or child in that hospital bed. So you need to look at this as if it is yours. It's not just a patient, it's family, it's personal. Adriana, you have your hand up, and then we'll go back to Ashenafi.
Thank you, Elliot. I just started reading the names in here, and I just really want to thank many of you that are, I see your names here, and maybe that are as participants, because of the immense help that we have received for all the medical devices projects in WHO during this last year. And I just want to say that it is assessment of innovations that has been done differently, changing the donations differently, ensuring local production and tech transfer, doing videos to training, even starting drafting a pre-qualification process, which I always have said no, and now we are we're drafting it. So I just really want to thank everyone that has helped to innovate in these times of crisis, and let's continue working together. Thank you.
We appreciate your leadership in that, Adriana. It's been a great team and a great outcome, and we have a lot more work to do, obviously. Ashenafi, you had your hand up. What would you like to share?
Thank you very much. I just want to add a couple of points. I think I'm so happy that we're just discussing about HTM innovation pertinent to clinical engineers. Unlike what we know previously, clinical engineers only to maintain and to manage devices. So this is a very good opportunity for me. When it comes to leadership, I think innovators are leaders, I believe. They are the one that will show us a direction. They are the one that will show us a product. They are the one that will show us ideas, ways to do things. So for me, innovators are leaders. And the second point is when it comes to leadership, I think how influential a clinical engineer is, what makes him a leader, because it's about influence. What makes you a leader? It's not about position. It's not about where you are. It's about the influence. So I think, thank you very much for the opportunity. These are the two issues that I want to add. Thank you.
Very good, Ashenafi. Thank you so much. I'd like to shift over to a moment to Roberto. Mexico has faced so many challenges like the rest of us, but unique to Mexico. Do you have any observations from your own work and leadership within Senatech and also within Mexico?
Thank you, Elliot. Good day, everybody. Well, certainly, having this important role in trying to lead the efforts for health technology management, but also health technology assessment, it's been quite interesting to say the least, and especially in these difficult times. Like never before, I think that we need to take this opportunity that this pandemic put the spotlight on us, on biomedical engineers, clinical engineers, and other types of engineering, medical engineering all around the world. So I think that we need to take this unique opportunity to make the best of it. Make the best of it
right
through or compromise with
never waste a good crisis.
Absolutely, absolutely. It's hard to say it, but now that we have this opportunity, let's make the best out of it. And I would like to add something that probably we didn't talk about during this wonderful today webinar, is that we also need to pass the torch, to the younger generation of clinical engineers that are behind us. It's the greatest opportunity that we have to, through the things that we do, to help in this crisis, tell them not only the good things to do, but what of the bad things that you did, they learn from it to not repeat it again. So I think that it's also really important to look after the younger generations of clinical engineers that are behind us. And here is probably an idea, and talking to Tom, that maybe a panel with students could be interesting to see what are their expectations, what are their concerns regarding this wonderful profession. Thank you very much to all, and congratulations to everybody for this wonderful today webinar.
Thank you, Roberto. With my grad students, they hear every session, they hear about the pandemic, and all of their assignments are circled around the pandemic. They might as well learn right now in real time. Dr. Coley, you had your hand up, and I'd like to then try to finish perhaps with Stefano, because remember, Italy bore the forefront and the end of the most critical parts of these surges. So Dr. Coley, what are your thoughts that you'd like to share?
Yeah. Well, I was thinking about the question that started this panel discussion about how we feel leadership. It's sometimes strange to me thinking about being one of the leaders, let's say so. I still feel one of those students that you were mentioning that went to clinical engineering conferences and looked at those big people. And so I would like to suggest to each of us and to other people about keeping being humble. With this, what I mean two things mainly. One that has been mentioned already, that is giving credit to the people that work with you. Just to give you a recent example, I've been honored to participate in one of the WHO projects. And one of my colleagues, who is here, by the way, listening to this webinar, Ilaria, she was so critical in putting together the final report and so on. So giving credit, giving space to the people that work with you. So many so-called leaders want always to be on the forefront and do not give space to the people that work with you. So I think this is one important thing. And the other thing I think that's important is to be available. I sometimes write an email to some people that is, not such a superstar person, and they don't even bother to reply you. And on the other side, you write an email to someone, do you think that he will never give you a feedback because he's so important people and they are so kindly available. So I think that is surprising how some of the greatest people you can find are the most available. Of course, each one has his duties and fully busy, but sometimes people just do pretend they are more important than they are. And I think that everyone has to remember that we have been those students not so much time ago.
Thanks, Stefano. Good points, good observations. Humility is critically important. Mm-hmm. We'll close with Dr. Coley, our good friend Dr. Coley, who he didn't mention. He was the Chief Medical Information Officer at the Cleveland Clinic, Abu Dhabi, and also the past chairman of HIMSS. As a physician, as a friend of the clinical engineering community, and a very seasoned executive leader, what leadership points would you like to share with us in this closing few minutes?
Well, thank you. And first of all, congratulations again for an amazing seminar and webinar. First of all, I'd like to say, Riyadh, I don't believe that CEs are Cinderellas. I really have come to appreciate and learn through my experiences that they're so essential. The challenge is, I did not learn about CE as a profession until I was probably in practice. And I think this tells us that there's probably an opportunity for the medical education system to begin a more inclusive approach to teaching medical students, nurses, CEs. And I wonder if there are opportunities where we can start to think about the medical education curriculum for tomorrow, because ultimately it's not about expertise solely in our domains. It's actually about problem solving in healthcare. And I think that is a discipline that needs to be called out, and we need to sort of look at stakeholders, whether it's pharmacists, whether it's lab technicians, whether it's nurses, CEs, physicians. You know, healthcare is a team sport. I, as a physician, frontline physician, would never be successful if I did not have a team behind me. And I'll share an anecdote with you. So Cleveland Clinic Abu Dhabi, when we opened and activated the hospital, we went live with 77 IT systems and 20,000 pieces of equipment. Mind-boggling, right? And as we sort of enter an era where care is becoming distributed outside the hospital, that number is going to explode, right? For a physician to think about making sense of that, it's simply not possible. And so for us to do more in terms of advancing medical education in a manner that reflects true reality, I think it's an important endeavor. And I think this is where organizations like, IFME, GCEA, HIMSS, and others really need to sort of come together and start looking at new ways of solving problems. So I'll speak as a patient in my final sentence. So when I joined Cleveland Clinic Abu Dhabi, I was the first physician to be hired. I was told basically we have a blueprint and a hole in the ground. We're building this hospital, which is going to deliver the best care in the Middle East. And so we used to talk amongst our teams, CEs, IT professionals, and others, let's build a hospital that if we were to be served by it, would give us the best care. And lo and behold, not only did I help serve on the leadership team that built the hospital, I practiced as a physician there, but I actually benefited because I had my surgery in the hospital that we helped create it. So what Elliot said is so true. This becomes such a special opportunity and a privilege that all of us have. We are now redefining healthcare for tomorrow. And this is a sort of a legacy building exercise that I think is truly an honor and a privilege to be a part of, and have colleagues like everybody on this webinar. I'm eternally grateful. So thank you for all the work that you do. And thank you really for Tom and Elliot for inviting me a couple of years ago to be part of the family. And you have my 100% support. And I think we've got a lot of work to do. And COVID has actually given us a little bit of firepower. So thank you again.
All right, that's true. Manish, thank you so much. As we finish up, I really want to thank the CED community. I want to thank our moderators for the presentations, all of the panelists for your brilliant contributions, and for the extensive participation by the attendees. We will be posting this information. We'll be sending you out copies of the slides and collateral. All be safe, be well. Thank you for the hard work you do all around the world in partnership and in collaboration with each of us. As I say to my friends, the life I save may be my own. Remember, these are our needs. These are our families that we're serving. Have a good day. Thank you.
Thank you, Elliot.
Thank you very much.
Bye-bye.
Thank you.
Thanks, everyone.
Thank you.
Thank you
very much for the
Thank you.
time.
Bye-bye.
Thank you.
It's an honor. Thank you very much. Ciao.
Thank you.